Hi guys, it's Matsabram and welcome back to my channel. Been a while since I posted on my channel because I just recently finished my residency in dermatology. I'll be giving an overview on how to become a board-certified dermatologist in the Philippines and also some tips on how to apply. I also want to take this opportunity to thank my parents, my family, my friends, my consultants, my mentors all throughout my journey towards becoming finally a board-certified dermatologist. So first, let's define what's a dermatologist and what makes a dermatologist board-certified. So dermatologists cover both the pathologic and aesthetic aspects of conditions of the skin, hair, and nails. So yes, hindi lang po skin pag derm. So we undergo 3 years of residency training in accredited institutions, so accredited by the Philippine Dermatological Society or your PDS. So after 3 years of residency, you would then have to take the diplomate exam, which is very challenging kasi it consists of 4. So you have the written exam, dermatopathology exam, the picture exam, and also the oral exam. Now, how long does it take to become a board-certified dermatologist? So as with other professions, syempre dadaan tayo sa grade school, sa high school. 4 years usually of college or pre-med course, 4 years of med school, 1 year of postgraduate internship, taking the physician licensure exam, 3 months of pre-residency, although it varies per institution, 3 years of residency, and again, finally, the diplomate exam. So after diplomate exam, the dermatologist would be given the title of a DPDS or Diplomate of the PDS. After that diplomate was able to meet 2 years of good standing and also other requirements, you now become a fellow. So yun ay magiging FPDS or Fellow of PDS. After that, some would opt for 1 to 2 years of subspecialty training or fellowship programs. Next question, is it super competitive? It's indeed a very competitive field, especially back then when there were fewer hospitals that were accredited by PDS. Applicants can even be as many as 100 per institution, then they'll only get about 5 to 6 on the average. It depends on the institution. Some institutions, there may be less applicants, but they would get less number of qualified residents. So remember that the chance to be in derm residency would be higher if you apply to multiple institutions. Some would even try year after year until they get accepted. Next question, are there fellowships or subspecialties in derm? A lot actually. So locally, what we have are dermatopathology, dermatologic surgery, and phototherapy fellowships. But aside from those 3, we also have hair restoration or hair transplant, nail, dermoscopy, complex dermatology, contact and environmental dermatology, lasers, and aesthetics, among others. Next, what are the advantages and disadvantages in entering a government versus a private institution? So as with other specialties, generally same naman. So for government, it's usually more toxic, daming patients, marami ding residents usually. Maraming admin work, mas common yung mga pathologic cases sa government hospitals. And generally, higher ang salary kapag government institutions. As compared to your private institutions, some would say less yung patient load, although it depends on the private institution talaga. There's fewer number of residents, less admin work, and they might have the advantage of having more exposure to aesthetic cases. But again, it depends on the institution. Generally, lower din yung salary for private hospitals. Next, do I need a connection or a backer to get in? The answer is no. It may help for some institutions, but you don't necessarily need it to get in. And remember, your preparation, your credentials, and your knowledge, these are your very own assets. Next, do I need to have derm case exposures or skills already at this point when I apply? Not necessarily. So it might help during pre-residency, but they don't expect you naman to have these skills kasi yun nga yung matututunan nyo during the residency program. I also advise you to read the FITS book while you're seeing cases during pre-residency. Next, so is it chill? Wala bang duties pag derm? For me, each specialty is difficult, but they are difficult in different ways. Especially during first year, lahat talaga mahirap regardless of the specialty. So I must tell you that it's not as easy or as chill as you think, as I thought also before I entered. And derm for me is very hard, even until now. Ang hirap mag-diagnose and treat ng diseases of the skin, hair, and nails. But relatively, compared to other specialties, the duty schedule would allow more sleep, and that might be a good thing for you. But please don't choose derm just because you think it's super benign. I think it's not a good motivation and you might get disappointed during residency. So you really have to love the field. It's a very visual specialty. And also, it's not just clinical work that you have to do here. Usually, maraming admin work, committee work, and this will really take a lot of your time. You will also be busy organizing events, medical missions, postgrad courses, webinars, as with other specialties naman when you're a resident. Next, what's the usual residency schedule or the duty schedule? So the schedule is a bit complicated. Super varied siya depending on the institution. But most would have no 24-hour duties except for those selected private hospitals, and also except if you are an IM rotator. So we also have IM rotation in derm kasi it used to be a subspecialty under IM. You may also have 24-hour duties if you're a senior house officer in government hospitals. The IM rotation in derm consists of 2 months of ward and OPD. And there's also subspecialty rotations in allergo, there's also endo or diabetic foot rotation, and also rheumatology because they're also connected to our derm cases. But generally, most hospitals, especially government institutions, have the 8 a.m. to 5 p.m. work schedule. But in some institutions, like in our institution, we also have weekends, but it rotates among the residents. So usually yung on-call, madaling araw, gabi, overnight, and on weekends, yan yung mga ward referrals team. Yes, because we also get referrals from different specialties. And also, even if it's supposedly 8 to 5, residents are expected to be there much earlier, like 7:30, and go home much later than 5. Especially for first-year residents. It's very common to go overtime. Next, if I previously finished aesthetic programs or training, can I still apply for derm residency? Definitely. Actually, that can be your edge because you're more familiar with the aesthetic aspect already. And it might also be good to mention that in your interview because even after completing your program, you're still interested or you still want further training to become a dermatologist. Okay, next, I was an average student in med school. Can I still get in? The answer here is yes, definitely. Use the entrance exam since that will make you stand out and have a higher overall grade. Also, try to attend postgrad courses of different institutions. And another tip is that a good research background is a bonus because in derm, research is also a very big deal here. So overall, the basis of grading na kailangan yung pagpondahan at pagtrabahuhan are your med school grade or rank, the board's rating, research, attendance at postgrad courses, the entrance exam, interview, case presentation, and eventually your performance as a pre-res. Next, what are the steps during the application process? So parang Hunger Games yan. Parang Squid Game. So I will give you sample number estimates so you have an idea. But again, this depends on the institution. So example lang so for example, 80 submitted the application forms and will take the entrance exam. So among the 80, only the top 20 will be interviewed. So it can be the next day or after a few days. Then among the 20, only the top 12 will undergo the pre-residency. So usually for about a week or several days. And it can be divided also into 2 to 3 batches. Then among the 12, for example, only 6 will then be accepted as incoming first years. But they can also be called pre-residents, but they're already accepted. Then these 6 now will be the ones to undergo the remaining months of pre-residency, usually 3 months, October to December. So more of shadowing lang yon. They see patients in the OPD, but accepted na as incoming first years. So again, examples lang to, numbers, and the sequence depends on the hospital. Next, what are some tips for the actual entrance exam? Sabi ko nga, ace nyo yung entrance exam. You have to master Andrews for that. You also have to confirm maybe with the institution if they would also be utilizing FITs aside from Andrews. You have to study even the less commonly encountered chapters like those on hair, on lasers, on nails. But remember, iba-ibang institution, iba-iba rin yung type ng exams nila. So some would have identification, mere enumeration, matching type, multiple choice. But multiple choice questions yung mas common. Next, what are your tips for the interview? So ito, hindi lang to pang derma. So siguro for all aspiring residents. Sa interview nyo before the residency, show them that you didn't choose derm just because you want a chill life or the work-life balance. It's not about that. Show them you really want the field even if there's no compensation, even if there's no salary. Ganun mo kung gusto yung specialty. You have to be familiar with the institution and the department as well. So, medyo familiar kayo sa history ng hospital, history ng department, the consultants there, and also maybe the services offered. They also usually ask about your strengths, your weaknesses, your hobbies, your skills, and show them na kaya mo maging good team member but also a good team leader. If they give you scenarios, just be ethical. Ethics is very important in dermatology. show them na asset ka talaga sa department. But, syempre, you have to be sincere, you have to be honest, and you have to be humble. So, after everything I've said, ano ba yung final tips ko for you if you're interested or if you're already going to apply? Apply to multiple institutions. It might help. Assess kung gusto mo ba government, private, or both. You may consider also your home location on which institutions to apply to. So, this is the list of the PDS accredited institutions as of today, and also those with applicant status. Again, Master Andrews, aim nyo lagi, kailangan matop ko yung entrance exam. Remember also, syempre, attitude and character is very, very important. It's not just about grades. So, you have to be kind, you have to be moral, and you have to be ethical. Tapos, syempre, bibo-bibo tayo. You have to show your eagerness to learn, especially during the pre-res na. And finally, study super hard, use the remaining days, weeks, or months that you have, and pray for the best. Basta nasa puso nyo, kaya nyo ring maging board-certified dermatologist. So that is it for this video, and I hope you learned a lot. So if you have more questions, just comment below, or you can also reach out to me in my Instagram or Facebook or TikTok accounts. And I'm glad you're here because I'm hoping to have a lot more derm colleagues in the future. Thank you very much, guys, for watching. Don't forget to like this video, subscribe to my channel, leave a comment if you have more suggestions on future contents in this channel.